controversy did develop around trust in science, misinformation, and confusion in the public. Well, wait a minute, you guys, do you really know what you're doing? And a whole bunch of people decided you didn't, and they're still on your tail, I gather. Help us understand this misinformation problem and how we could possibly do the mistrust of science.
Yeah, well, we certainly have a significant and unfortunate mistrust in science and scientists right now, and we have to do the best we can to turn that around, and it's not going to be easy. And it relates to, and as I say, because I don't think, and I've never been this way in my entire life, of blaming people for things that happen, but it is unfortunate that there is a lack of understanding of what the scientific process is. So I try to explain it. People listen, but the people who've already made up their mind, it's difficult to get them to turn around. But you shouldn't give up. I want to keep extending ourselves to them. Is that science is a process. So it is, people confuse science with scientific information. The science is the process that gathers information, gathers data, gathers the kind of things that you use to make a decision at a given time. Science, by its nature, I'm telling you things you already know, and I'm aware of that, is a self-correcting process. So if you look at the information we had in January of 2020, the scientific process of epidemiology, of fundamental basic science, of clinical science, tells us that the information we have now says we should do this with regard to, should you change what you're doing in your life? Should you wear a mask? Should you really separate from people in the sense of social distancing or not? You go 2 or 3 months later and the information changes, and the scientific process, which is self-correcting, then looks at what we know in April, May, and June and says, wait a minute, now that we're seeing the virus is very well transmitted, not like what we thought early on, where it was like SARS from 2002, where you had 8,000 cases and 781 deaths, and pure public health practices, identification, isolation, quarantine, put it down. It stopped. Different. Number 2, it's spread by aerosol. Number 3, unlike other infections, 50 to 60% of the transmissions are from someone with no symptoms. So it isn't as if you walk into the room, if somebody's coughing, you just move away. You walk into a room and everybody feels good, and 50% of the room gets infected. We never ever knew that. And as you get that further information, then the scientific process, which is self-correcting, says, wait a minute, masks are really going to be important. Social distancing is going to be important. The fact that we now have hospitals being overrun, we've got to do something to shut it down. So the scientific community is doing what science should do, is gather information and make a decision. The misinterpretation is that these things are immutable. And they say, if you have data that doesn't change, and you change your recommendation, that's flip-flopping. If the data change and the disease evolves, and you change your recommendations based on the evolving information, that's keeping up with the scientific process. Unfortunately for us, what was interpreted by a significant number of people was that they told us one thing one day, and then they told us another thing another day. So, what are you going to believe? They don't know what they're talking about. That is complicated by the fact that we have to admit, in all modesty, that sometimes the messaging was garbled. So nobody's perfect here. The scientific community and the public health community and the CDC, and even me in some respects, could have done a better job in the communication. But the core issue was the thinking that you're dealing with a static situation. when the situation is extraordinarily dynamic. I mentioned it to the group when I was talking this morning. It's a simplistic explanation, but there are mathematical sciences, physical sciences, and biological sciences. In January of 2020, as I often say in a simplistic way, 2 + 2 = 4 in January 2020. In December of 2024, 2 + 2 still equals 4. Look at the virus in 2020. It was the ancestral strain. Then we had Alpha, Beta, Delta in the spring of 2021. And then in Thanksgiving of 2021, we had Omicron. And then if you go to the CDC website and you plug in the phylogenetic tree, Omicron has about 50 branches. We're at XEC now. We were at the others, KP 1.3.1. It's so many different. So it's a very dynamic situation, and that is very, very difficult, which means both sides have to do better. The public has to be a bit more scientific literate, and we have to contribute to that by talking about things in a simple way that people can understand it. But the scientific community also has to be much clearer in how we explain this very dynamic situation. All of that has contributed to this confusion about, can you believe scientists, can you believe science? That then is also complicated, sorry, but it's what it is, by people of nefarious purposes, who actually, everything is a conspiracy. And no matter what happens, it's a conspiracy. And you put all that stuff together and you get a smorgasbord that's really pretty difficult to untangle.
Yeah. Wonder if we have a project here to help the public as much as willing to listen to understand what you said. You reminded me, you arrived after Keter Monte's keynote address today. Keter was the outgoing CEO of HI, and he told a story in his family about trying to move from confrontational problems within the family to a question. Would you like to be helped, heard, or hugged? And Keter was suggesting that that's a very important question, and you don't know what the answer will be. But one answer, one through line to everything you're saying, back to AIDS, back to the pandemic, the trust of science is heard. It's like you're trying to find a way to hear each other across these boundaries.
But you're not going to hear each other unless you listen to each other. And that gets back to what I was saying in the early years of HIV. The scientific and regulatory community was not listening to what the activists were saying. And if there's one thing that I did that I feel good about, is that I put aside the theatrics and I listened to what they were saying. And that's what we really got to do.
I'd argue the same, something with George W. Bush. There must have been a moment in which he heard, he listened to what was going on.
Yeah, I mean, he has a great deal of empathy for people who suffer. He just did. I mean, whatever you think about him for other aspects of his ideology, he really is sensitive to the suffering in the world. And when he saw a suffering that he could do something about, that's when he said, do it.
What do you think the